This is Healthcare Now Radio's Trending Now. Get ready for an exhilarating 30-minute ride through the latest topics driving change in digital health across the news and social media. Join us as our subject matter host takes the lead in uncovering what's hot and what's not. So buckle up and tune in to stay in the know.
Welcome to Trending Now on Healthcare Now Radio, where we explore the forefront of healthcare innovations and transformations. I'm your host, Shahid Shah. Today, we're really thrilled to have Michael Meucci, President and CEO at Arcadia. And what's trending now, for sure, what Michael and I are going to talk about is how healthcare organizations can maximize their return on investment from AI. It's a very popular topic, but really we have to figure out how to anchor innovation in really, really strong data foundations so that it integrates well in real world workflows. Unlike many other industries where you can adjust the workflow a little bit easier, in healthcare, it's really, really hard. So trying to find out how Michael is helping companies with that understanding of taking AI with strong data and integrating into real world workflows is something I'm really, really excited about getting into. But first, there's some really big news coming. Arcadia has just announced a strategic partnership with Nordic Capital, and we'll talk first about what that means, and then we'll jump into the rest of the conversation with AI. First of all, Michael, thank you so much for joining us. Tell us a little bit about yourself first, and then tell us about this big news that Wall Street Journal just reported about Nordic Capital acquiring a majority stake in your company.
Well, great to be here, and thanks for having me on the show. We're really excited about the partnership with Nordic. They're a really focused set of investors with a very clear thesis around the opportunity that exists in the healthcare market to transform the way we deliver care and really pay for care using data and AI. I've known the Nordic team for a number of years. We've stayed in touch just given their thematic focus on the sector. They invest about 40% of their fund in healthcare technology businesses in the payer, provider, and the life sciences ecosystem. And with the scale of their resources, that means that they work with some pretty big players, folks like Inovalon on the payer side, Clario on the life sciences side. And as we were catching up over the last 12 months, I've been having a continuous narrative with large cap investors around the real imperative that we face in the United States to continue to advance the adoption of new payment models to reduce the overall cost of care, and how we live in a moment where technology has finally caught up with the care delivery needs. I'm not going to come and say that we're replacing physicians with AI, because we're not ready to do that. That I don't think we'll ever see that. But we're at a place where you can really scale value-based care programming with AI. And if you look at the policy trends coming out of Washington, you're starting to see RFK and Dr. Oz really pushing for a lot of the same types of implementations. Wearables for all consumers, more AI. There was a model announced yesterday, the Wiser model, which is focused on bringing effectively prior authorization to fee-for-service Medicare. All of these require massive data chassis, massive AI tooling, public-private payer-provider collaboration. And that's the business that Arcadia has built. So as we talked about a lot of those trends, Nordic expressed their interest in finding a way to work together. The timing was right. The deal terms were right. And most importantly, the strategic alignment was right. What I'm most excited about in the partnership between Arcadia and Nordic is they're backing my team, our plan, and that's an exciting moment for the company and for the market.
Yeah, and what I love about that, Michael, is that you guys recognize that what you're trying to do is really, really hard. And doing that with a tiny company with a small amount of capital is difficult. But if you've got big ideas, and then you have a big brother that can help you fund those ideas and keep them moving, that, of course, helps your customers understand, hey, I'm not going to talk to Michael today and then somebody else a week later because they're out of business. What I love about especially when I see these kinds of funds that are highly specialized, invest in highly specialized companies like yours, is that when capital meets idea, good big things can happen. And in healthcare, they all have to be big things, because you can't really do small things in meaningful ways in healthcare, especially with AI taking the investment that it has. So as we talk about that, there's a bunch of discussions that have happened in the last couple of years around Gen AI in healthcare. Maybe set the stage for us a little bit as to what have you seen in terms of McKinsey, for example, reported just about a week ago in a recent report that a large chunk of enterprise AI is not making it beyond pilot stages. And so talk about that a little bit. Is what are you seeing that it is being successful, whereas other ideas may be stalling or may not be as successful in AI that people were predicting? Just some landscape setting, maybe.
It's a really important point, and it's something that I think we all need to be really attuned to as you start to see AI businesses reach sky-high valuations. The adoption curve in healthcare is incredibly hard. And I know we're going to talk a little bit around how you integrate AI into the workflow. I think we have to learn from direct-to-consumer businesses on how they've implemented AI to drive consumer comfort with AI. And I'm using consumer not just you and me as a patient, but I'm using the physician, the nurse, the care team as users of AI technology to mean consumer. But we need to think about how you bridge that gap. The last major technology revolution in healthcare was the implementation of the electronic health record over the last 20 years. That was hugely disruptive. The productivity gains that were expected from the implementation of digital charts were largely not seen. Now, what was seen was revenue growth from more complete code capture, clinical decision support, better care. So I don't want this to be perceived that I'm saying EHRs are a problem, although some physicians will say they are. But I will say that I think there was a broad belief that productivity gains would come from EHRs. It has not been realized. AI to me is the tool to drive that productivity lift in healthcare. But if we don't learn from the challenges we faced 2 decades ago or over the last 20 years as we implemented EMRs, we're gonna face the same fate. And I think that that's why you're seeing a little bit of this pilotitis. There's a great CEO of a hospital in Florida, the CEO of Tampa General Hospital, John Koulis. He was at a conference a few years ago, and he said that a pilot is a slow no. And I think that there are 2 factors that are impacting AI pilots. Well, maybe 3. The first is you have to buy into these AI solutions and you have to sell out to them. And I can give you an example of how we are doing this at Arcadia. It's really hard. It makes people really uncomfortable, and you have to bring them along on a journey. We've recently implemented Cursor, which is a co-pilot for software engineers that helps generate code on your behalf. And we are monitoring, as part of our implementation of Cursor, how our engineers are using it. And we're publishing benchmarks. Our best engineers become incredibly powerful with tools like Cursor. Our engineers who need more support may not have as much of a productivity lift, and it becomes an imperative for management to then work with them to help them understand how to better use those tools. You can't just go flip a switch on an AI solution and expect that everyone's going to adopt it at the same rate or even know how to interact with it. So I think the first thing is really being thoughtful about deployment and having management really sold out to not only implementing, but growing the adoption of that solution. The second kind of challenge in these pilots is you're seeing like a lot of sprawl. If you ask payer or provider executives as to where they're deploying AI, you hear everything from I want to automate more of the prior authorization back and forth, all the way through to ambient scribes, to ways that we're using AI like data quality monitoring, data health monitoring, or more administrative features like patient engagement, outreach, coordination. That's a lot to do. I mean, you talk about boiling the ocean with a lighter. Like we're in a space where there's a lot of these projects. Hospitals and health systems are incredibly resource constrained. It's not been a great financial economy for the healthcare ecosystem, despite being a massive part of GDP. It's not giant profit pools. And then I think the third piece is there's still a little bit of distrust. I talk to a lot of healthcare executives where they're facing increased pressure from workforces that are unionizing, and you're hearing collective bargaining asks that say, I don't want my job to be replaced with AI. At some point, we do need to realize productivity gains in AI. I think that we can realize productivity gains by scaling an individual, allowing them to do more with the same fixed amount of time. But realistically, you're seeing a shift in budgets with the deployment of AI to say we're taking labor budgets and we're going to start spending it on technology. And that technology should then make our labor happier, more effective. And I think that we've got to get through this transformation phase to get there.
Yeah. And one of the things that caught my attention as to something that you guys teach the industry really well, Michael, is that that data should be the starting point of these discussions about where maybe some of these pilots or initial deployment should go. So briefly tell us, what is the current state of data with respect to most of the customers that you see? And do some of them start in the wrong place? Like if we have EHRs, should be starting with AI related to EHRs, or is there some other way to make a decision about where to start based on the data that you do have that might be unique to you?
I think starting with the data is the definitive starting line for all of these AI journeys, because your data will dictate what you can accomplish. I want to be really clear. That doesn't mean you need to go spend millions of dollars on cloud data infrastructure and bring all your data together. I would love that. That's my business. But every stakeholder in healthcare has enough data to deploy an AI use case. Let's take just the EHR. If you're a 5-doc practice, you have a cloud hosted EHR, maybe you don't have claims data, maybe you don't have any data from your local hospital facility and HIE. That doesn't mean you don't have enough to do something. You can deploy an ambient scribe, which could create really nice productivity gains as you start to think about having support in listening to that patient encounter, helping to transcribe and codify that encounter for billing and submission purposes. It's a very effective use case. And if you look at one of the most scaled applications of AI today in our industry, it is really ambient scribes. You've got a bunch of businesses out there. Bridge has made great progress in deploying their tool nationally and to their platform nationally. And it doesn't require you to have all the data on every encounter a patient has ever had, because it's in that encounter, it's listening to you there. But if you start to think about some of the use cases in the world that we touch around helping to identify ways to bend the cost curve or helping to improve quality, it's really hard to make recommendations around the next best action for a patient without the context of all of the encounters that you've ever had. It's very hard for me to say that a patient needs to go get a colonoscopy if I don't know about the patient's claims history. And so that's where I think you can start with the data to map out what your AI roadmap should look like. There are also certain applications of AI that don't require a ton of data. As you start to think about tools to support patient scheduling or tools to support staff scheduling, like they need a much narrower set of data. So again, starting with what you have and perfecting these use cases, getting them on autopilot, and then picking your next one and growing from there is a really effective way to think about this.
No, that's such good guidance. And if you're just tuning in, you're listening to Healthcare Now Radio. This is Trending Now. I'm your host, Shahid Shah, and I'm having a really great conversation with Michael Meucci from Arcadia. And we're discussing how Arcadia's new partnership with Nordic Capital is going to help accelerate the responsible and scalable use of AI. And so let's talk a little bit, Michael, about decision making. So when you try to enhance the humans in the flow, some things are about making things faster. And that's what EHRs used to promise us, but they don't promise us that anymore, because we know that making a slow process with a computer just makes the slow process even slower in some cases. It's not going to make that faster. But we know that AI today has the ability to assist with a key part, which is faster decision making. Tell us a little bit more about what is the technical and operational readiness of AI for decision-making kind of roles that may be stuck today without AI.
One of the best examples of where I think AI is going to rapidly accelerate decision-making is helping with the decomposition of the vast amount of evidence that our healthcare system produces every day. I often use the quip that working in healthcare in 2025 is like the opening passage of Dickens' A Tale of Two Cities. It was the best of times. It was the worst of times. We live in a moment where vaccines, pharmaceutical products, technology, AI, cloud computing are better than they've ever been. At the same time, we live in this incredibly resource and margin constrained environment. So you have to balance those two. I mean, if you look at the debate around GLP-1 drugs or the implementation of AI, everything requires resource. And where is that resource going to come from? We also generate, as a healthcare system, an enormous amount of very good research. If you look at chronic disease progression, 2 weeks ago, the FDA approved a twice a year effectively vaccine for HIV. It's not an HIV vaccine, it's a PrEP drug. But at the same time, like going from where we were in 1980 to 45 years later, having a twice a year injection that can prevent seroconversion, that's a remarkable feat. That generated tons of studies, tons of evidence-based practices, and physicians are under more pressure than they've ever been under to provide care for patients. They're burning out at a higher rate. We should be very concerned about our clinical workforce that is not growing at the rate that we needed to provide care for all of our citizens. And asking those physicians to then go and process all of this new evidence to change their care protocol, it's really hard. I was recently in Salt Lake City with one of my customers. One of their lead physicians said, when I graduated from med school, and this physician is about my age, he's about probably in his mid-40s, he said SGLT2s and GLPs were not part of the standard diabetes care protocol. And they are now for certain patients with certain comorbidities. And so how do we then use AI to digest all of these updates to evidence-based practices, evidence-based guidelines, and then inject a next best action hook or suggestion into the EHR? And that's exactly what Arcadia is working on with our customers, is to grab all that information, use specifically tuned large language models that know healthcare terminology, that know the healthcare system and the reimbursement models in the US, understand prior authorization, to say, for this diabetic patient with congestive heart failure, the most appropriate clinical pathway is this prescribed pathway that's been trained on hundreds of millions of patient journeys throughout the country. That's the time saver. And it's not just a time saver, it's a lifesaver. And so you have this opportunity with AI to elevate the physician, allow them to return to the joy of practice, shorten the diagnostic journey, and provide better care. I'll stop in just a minute, but my chief medical officer, Dr. Hansen, has this great analogy that physicians are trained to think of horses when they hear hooves. And he will often remind me that horses are not the only animals that have hooves. Zebras have hooves, and they have different care needs. And so AI is really good at figuring out, does that four-legged hoofed animal have stripes or not? And do those stripes mean it's a zebra or just a fancy horse? And so that, I think, is the era we're entering into with technology and medicine.
Yeah, and what I love about that analogy is it really helps us understand that the culture part of this, like even Dr. Hansen, who is mindful of all of this stuff, probably has in the back of his head when he's looking at something that even if the AI gave him the answer, he's still thinking maybe he needs to try to override it or think about something else. And that leads to culture change. And adding, and you guys have talked about this in your papers as well, is that embedding AI into day-to-day workflows, and instead of bolting it on, kind of like what you're referring to, has real value. But you've also articulated that culture change and understanding how the human part of this equation needs to work must be at least adjusted, if not improved. And I don't always say improve versus not improved, but I say just changing the culture is big enough. So tell us, what does Arcadia know about culture change that helps you drive some of these solutions faster in your customers?
I think the way we're thinking about the change management effort is really looking at our platform as a set of distribution rails. When you think about the scale at which we are deployed in the US healthcare system, we're connected to about 40,000 individual provider offices. That means that we have the ability to deploy solutions in workflow. They're already being used. How do we push AI solutions into those existing experiences versus having you go into a new experience? One of the best developments that the EHR developers have made over the last 5 years has been the implementation of CDS hooks and Smart on Fire that allows you to get insights into the EHR experience, allowing the physician to stay in that single pane of glass without coming out of that experience. If you think about zooming out of medicine, if you think about your day-to-day life, whether you have an iPhone or an Android or use Gmail or Outlook, they've all started to integrate generative AI support into their applications. On my iPhone, I start typing an email and it starts to type ahead for me. And I can just click the space bar and it'll complete a sentence. Sometimes it's right, sometimes it's wrong. That's human in the loop reviewing AI. And that's what we're going to see in medicine. And that's what we need to get to in medicine is the ability for AI to work seamlessly in your existing experiences. I can tell you with certainty, OpenAI and ChatGPT does a better job of writing emails for me than my iPhone and the native mail app does.
Yeah.
But for 90% of use cases, what's built into Apple Mail is fine. If I have to write a long email to customers for my board, like I'll go over into ChatGPT and like prompt it and work on the prompts. But again, I think that the integration of that in my existing experience makes me a much bigger adopter in that native mail app. And that's how I think we are thinking at Arcadia about the integration of AI is how do you pick the right model, the right tool, and integrate it so that when you think about training, it just feels second nature. And that's why I think healthcare developers and technologists need to look at big tech who've prioritized user experience really well. User experience is not often thought about in healthcare. And it's been a big differentiator for Arcadia for a long time, is thinking a lot about the UX of our solutions. We're getting even more focused on that with our partnership with Nordic because we see an opportunity to use this distribution network. Daniel, the co-head of healthcare at Nordic, has said, Arcadia is effectively the interstate highway system, and now our job is to put more cars on it. We've built the infrastructure. We can now put experiences on it.
No, I love that. And in fact, when you think about the massive reach that you guys now have, that of course started with a lot of skepticism many years ago. This AI is one of those very few things that where senior leadership is a lot less skeptical than day-to-day physicians. It usually is where day-to-day physicians are bringing things to leaders and leaders like, we don't know how to do this. But now you see the inverse. The board is asking the CEO. The CEO is asking the VPs and operations people. How are you guys handling the skepticism? Or given your size and scale now, are people still skeptical of what you're bringing them? Or have you moved beyond that in the leadership side?
There's skepticism every day. I think part of the skepticism is just change fatigue. This industry has been changing constantly since 1990, and it's a continuous wave of transformation. I think that leaders, there's actually a barbell. If you think about, like, you've got boards and executives thinking about AI because they see it as a path out of a really challenging situation. Then you have some of the newest members of the workforce who have been using AI a lot more than the middle, 70%. And I think that it's actually an opportunity for leadership to collaborate with the newest entrants to the workforce to change the way we deliver care. And I'm actually zoom out of healthcare, really any industry. I'm pretty excited about that dynamic, but it's not that different. Every time you have a new class of technology-enabled, smart young people, they change industries. If you look at some of the smartest and most successful entrepreneurs over the last 30 years in the United States, most of them are really young, and they partner with experienced board members and investors to effectuate that change. So as we zoom back into healthcare, while there is certainly skepticism, I often encourage our customers to focus on administrative use cases where they can really have eyes, real human in the loop on those outputs to make sure that they're attacking that skepticism and focusing on building trust. And it's a journey, just like getting people to use EHRs was a journey. Today, there's no question. But when I started this business, 15 years ago, there were still a lot of doctors on paper, and they were skeptical. I'm never going to use an EHR. A lot of those people have retired. And now, you take a new trainee out of residency. If you said you were on paper, they'd be like, "What are you doing?" Of course, you're not on paper. So I think that you're going to see the skepticism burn down as we start to see these models get better. I'll kind of pause. My last thought too is everyone has to remember that the AI we are using today is the worst AI we will ever use. And that is like unfathomable because it's so good. It's not perfect in many ways, but it's remarkably good.
Yeah, no, I love that last piece you said. So in the last minute or so that we have, if you were giving one piece of advice, knowing now that you've instructed that this is the worst piece of AI, how do CIOs and leaders get started with the worst AI that we'll ever use? and then which will get better over the next few months and years as things come along. Maybe something they're not always thinking of, something unobvious that you've run across customers over the last few months in the last 30 seconds that we have.
I think I have a pretty broad piece of advice. And it was a piece of advice that was given to me by an AI investor. Encourage your leaders and your teams to sit down with a blank piece of paper and take a process and say, if I had to automate this process end to end, what would it look like? Write it on a piece of paper. I'm not saying that you have to do that, but I want you to bend your brain to think about the art of the possible. Think about where you can use deterministic and generative and agentic AI to completely take the human out of the loop. That's your ideal 5, 10, 20-year end state. And then you can map backwards and say, okay, great. We don't really want an agent providing patient care. That's a hard barrier. Great. Rip it off the paper and say everything up to that. Pre-visit preparation, collection of medical records, understanding the family medical history, crunching the data to understand health risks, potential diagnoses. Yeah, we're comfortable with having a generative or an agent build that up, but I want that to be reviewed by a physician. So that, to me, that exercise of complete white space, throw away everything that you know and think about what 20 years in the future would look like, I think is a very fun one. I call it the Jetsons exercise. I grew up watching the Jetsons, and you had these flying cars and a robot maid. And I guess we're kind of there. I got a robot vacuum. It's not as attentive as Rosie, but it is named Rosie. So I think that's a fun recommendation. I use it a lot with my management team.
And it's a great recommendation. In fact, we've referenced this particular paper just a few years ago. I think it was in New England Journal of Medicine, published a paper by a physician from a health system in Hawaii called "Stop Doing Stupid Stuff." And if you're not sure how to make a blank sheet of paper, just go get that paper, look at all the stupid stuff that we do today, and maybe that's a way to do what Michael is suggesting here. And with that, I know we're out of time, and we used up all of it pretty quickly. Michael, I want to really, really thank you for your insightful perspectives on Arcadia's exciting new chapter here. You guys are already leaders, but we have a lot to learn from you. And to our listeners, thank you for joining us on Trending Now on Healthcare Now Radio for this engaging discussion. Stay tuned for more episodes. We'll see you next time.
Thanks, Shahid.